Erica De Leon is our latest faculty member in the Faculty Spotlight. We're here at the South Campus. Hi, Erica. How are you?
Hi, I'm doing well. How are you?
I'm doing well. Thanks for your time. You're actually here at the South Campus, but you are going between campuses, right? You're at the Fort McIntosh campus as well?
That's correct.
So
yes.
how does that work?
Mondays and Wednesdays, I'm teaching at the Fort McIntosh campus, and then Tuesdays and Thursdays, I come to this campus and teach here. So I get the best of both worlds.
That's interesting. What's that like?
I feel like I get to see both sides, just students are just great students, and I love how I'm able to get like just the feedback from both sides, and just I don't know, it's just fun. I get to see everybody, different faces, different communities. And like I said, in a nutshell, I get the best of both worlds. I really love it.
Do you have an office at each campus?
I do.
Oh,
Unfortunately,
nice.
I have an office at the Fort McIntosh and also here.
Which one's the neater office?
Let's just say I'm in the process of moving, so here definitely it's much
right.
nice. Yeah.
So you're in the kinesiology department. You teach kinesiology. I don't know why I have a hard time saying that. So what exactly is that?
Well, kinesiology literally just means study of moving.
Okay.
But with that, I do teach 3 core classes. I teach kinesiology 1304, which is pretty much, it's personal community health. You can pretty much see it as a advanced health class.
Okay.
We teach a series of like cancer, cardiovascular disease, health and wellness, nutrition. It's a combination of all the dimensions of wellness, so which is great. And then I also teach kinesiology 1301, which is the foundations of kinesiology. Kind of takes you to like the back history of it, from the Olympics, Roman times, all the way to present day. So that's really interesting. And then the last core class I teach is kinesiology 1346, which is drug use and abuse.
Okay.
So, which is a little more intense as far as the content. And then because I teach academic and activity classes, I also do weight training, indoor cycling, body sculpting, and I've also taught aerobics and Zumba to the employees and students.
So do you do that all the time, every semester, or does it change?
It rotates, actually, depending on enrollment and the needs of our students. Definitely it can rotate, so it can be different one year than the next year. But
now you mentioned their core classes. Does that mean students have to take one of those 3?
correct.
Or they have to take all 3?
Yes, no, they'll take, depending on, obviously, if they're not kinesiology majors or they're not seeking a degree in the field, then they just choose one of those. Sometimes our students do love the way that the professors teach the content, so they'll come back and they'll take another one. It's kind of seen like sometimes they'll take them as electives. Activity classes also are very popular among our students. But yes, they do have to take them, they have to kind of pass through us. And then if they're seeking, obviously, the degree, then they do have to take all of them.
Can't avoid you then, huh?
You can't avoid us. No.
Out of the 3 core classes, which one's the most popular?
I would say kinesiology 1304, which is personal community health. I think students really like the fact that we hit on the components of mental wellness, emotional wellness, physical wellness, and they can really relate. So we hit some really deep nerves when it comes to that, and students really feel connected with that information. And they just say, I feel like they learn a lot about themselves and also the community and how they can become a better version of themselves.
And now more than ever, we're understanding the impact of mental health and its effect on individuals. And after what happened with COVID, it's really changed things. Let's go back a little bit. Let's talk about yourself. How long have you been a teacher? When did that journey start?
Well, thanks. That's an interesting question. Actually, my background is in the medical field. So I went to school to become a physical therapist. I have a bachelor's in pre-physical therapy, which feeds into the physical therapy program. And then after that, I did work in the medical field for about 20 years. About 10 years ago is when I switched career paths. And so I've been teaching from pre-K 3 all the way to the college higher education level. And so here at Laredo College, I have been here for 6 years in August.
Okay.
So yes.
So what did you do in the medical field for 20 years?
I actually did physical therapy, speech therapy, occupational therapy, a lot of the front and back side of it, the billing, the coding, just pretty much anything, the treatment, worked under a doctor's license, and it was just really interesting to kind of see everything. I actually worked in a home health as well.
Okay.
So I got to see all different areas of the world.
Why the switch? How did that happen?
I felt that, well, my mom's a teacher, so I felt that I was already,
It's in your blood.
it was in my blood.
Okay.
And the passion was there. Just like my patients, I do instruct them on therapeutic exercises, so I felt like the instruction was always there, the teaching mechanism was always there. Now it's a little different, but I just felt that it was my calling, and the only way to get into the field was as a physical education teacher. So that's how I got into the whole realm of PE, and then I actually taught science because my background in science. I do have a Master of Science from UTSA, so that kind of fed, it right into that pathway for me, and so I decided to come to LC. I've actually just been here for 3 years. I was living here for about a year until I finally decided to apply to LC, and been here for 6.
Wow.
So before that, I was in San Antonio.
So what level did you teach before coming here?
I was at the high school level.
The high school
Yes.
level. How was that?
It was great, actually. I really loved it. I missed it. I worked at Gateway, which is now Triumph Public High School. I worked with the high school students, and I really just enjoyed it's a whole different dynamics. High school students need a little more shaping up. They don't have to pay for school, so I think it's a little different, but
It's a different dynamic for sure.
Yes, I loved it. I really did.
Moral of the story: you can have more than one calling. You've had 2.
Absolutely.
You may have more for
May
all
have
we know.
more, yeah.
So do you still do some physical therapy work on the side?
I don't.
Okay.
I don't. It's just purely right now just teaching education. Yes. Switch gears completely. Yeah.
And at the high school level, what would you teach? I mean, did they call you coach? Were you a PE coach?
No, at that moment they used my the Master of Science helped me out there. So I was teaching physics, chemistry, biology was my calling.
Okay.
So I was teaching for the biology star, and it was great. Like I just different, coming up with different teaching methods for the students, instructional methods, just different ways for them to remember things, the strategies. I just felt like that's where it kind of said, you know what, I feel like I needed to just keep moving along, and I really loved it though. It was just great.
You have a lot of experience in many areas, it seems like.
I do.
And how did the medical field prepare you for what you're doing now?
Well, part of the medical field, because I had patients, and a lot of times we receive doctor's orders, like for example, somebody who has a knee injury or a hip injury. We usually instruct them on how to perform exercises to strengthen the muscles, to get them back into their activities of daily living. A lot like that, we teach students, through practice and through repetition. And so I think one within the same, my students are my patients are my students. And with that, the instruction just really helped me, guide students to make sure that they're successful in all that they do.
If somebody chooses to continue in kinesiology, what are their options? What are their possibilities with this degree?
Well, with it, they need to have to continue their pathway. So with kinesiology, they can go into fields like physical therapy, occupational therapy, physical therapy assistant. They can possibly even go into the nursing field. They can go into the teaching world. Kinesiology has many different areas: exercise science, sports, biomechanics. Cardiovascular fitness, respiratory fitness. They can chiropractor. They can pretty much do it all, just with the glimpse of this field.
Have you seen students from here continue on in the nursing program?
I have.
Yeah.
Yes, I've actually had I teach honors classes too. So a lot of my honors students are trying to get into the nursing program, and either they're already in there or they've already graduated. So it's beautiful to see them continue.
Maybe I should ask you, what don't you do? You seem to do a little bit of everything.
A little bit of everything.
What has the college teaching experience been like for you?
I feel that it's great to teach students who are willing to learn. I feel that because a lot of times they may not be on financial aid, maybe they are, depending on their situation. I feel that students really do want to continue their education. Students really want to be successful and graduate. I see that. I feel that through my classes. Students teach me every day, and I see that they're responsible. I see that that they're ready to get out into the real world. And just their motivation is really great to see. And this college experience has taught me to, that it's never too late to continue your education, to continue your pathway. And I'm a prime example that it's never too late to switch career paths, because you never know. You never know what's in store for you.
I think it's interesting that you said students teach you.
Yeah.
That's, how do you mean that? I guess.
When I teach, I encourage a lot of discussion, and so a lot of times they give me their feedback. Like for example, I just lectured on stress, and so a lot of times I have them do different stations, how to cope with stress. One of the things I do is I put them in 3 stations. One where they have to find music or something calming, nature sounds, piano, anything they find that's calming, and I have them choose a song or a video, and then they listen to it for about 2 to 3 minutes. In another station, they draw how they feel when they're stressed. And in another station, they do belly breathing, which is box breathing. For a count of 4, they hold their breath. Then they hold it for 4, and then exhale for 4. So inhale for 4, hold for 4, exhale for 4, which is why it's called box breathing. And so I have them in these stations, and then they give me feedback. And I think that's where I learn from them. I'm like, really, like, this is, which one was your favorite? Why? Why was it soothing? Why were you able to manage your, or how can you incorporate this to your everyday life? And so right there, they teach me their strategies, and I learn from them, and just their feedback. And I feel like it also teaches me to become a better version of myself. And every day I'm learning.
That's awesome. What would you say your style of teaching is, I guess?
I like to use technology a lot. I use Mentimeter, where they have to, sign in through their phone or a laptop, and they have to give me back feedback on a specific topic through words. We call it word cloud. That's how I kind of also give them a preview of the lecture that I'm about to get into, so they know exactly what they're going to get themselves into. Kind of like when we watch a movie, we watch the previews to know what we're gonna get into. So I use technology quite a bit. I also use Kahoot, which is like a competitive game, and so I always say, top 3 winners, you get this, or you get a freebie on a quiz, or just to kind of enlighten. I'm very just. I just like to make it fun and engaging for my students.
Yeah, and I like to ask the question, if somebody gets their schedule and they see Erica de Leon on their schedule, what would you want them to think?
I want them to think, this is the teacher that's going to care. This is the teacher that's going to go above and beyond. And through that feedback that I see on my student evaluations on ratemyprofessor.com, I see that. And it makes me feel really good, because that's where I see, that's how I learn to become a better teacher. That's why I'm learning from them. And I know that they feel that the connection is there. Even in my online classes, you want to make yourself you want your presence known, and students need to know that they're not alone, whether in the classroom or they're online. And I'm a firm believer that students need to know who you are. And if they see me, I've actually had a student come and visit me, even though they were in an online class, they found where I was, and they're like, I wanted to meet you. And it just feels great. That's how I get my motivation to continue becoming a better teacher. And so I want them to feel that I'm here, and that I'm not going anywhere, that I'm going to help them succeed and see them through success.
I love that you're always striving to be better, and I love that you're not afraid to use the technology today, because it's there, right? So let's use it. What is teaching an online course like?
I love it. What it is, it's a lot of self-discipline for the student and for myself, because a lot of times, students feel, hey, well, what am I doing? Maybe it's their first time. Maybe they're transitioning from high school to college. This is their first class, and it's online. So at this moment, you're thinking, well, I need to make sure that the navigation is simple. So a lot of communication, a lot of emails, a lot of just videos. We have something called Watch Me. So that's how I title my video, so they know that they have to watch me. Yeah. And I do a lot of Zoom recordings. My lectures are all live, and I record them, and I make sure that I also understand that students may not have the ability to meet with me. Hence, it's an online class. So that's why I make those videos accessible to everyone. But again, just that self-discipline to make sure you keep up with grading, make sure you're staying on top of those emails, and that you're clarifying everything so students know what to do. And I think that's the biggest concern.
Sounds fun.
Yeah,
I kind of want to take a kinesiology course with you. What does Erica de Leon do when she's not teaching and helping students?
Well, I just had I just had her. She's going to be a year, but my first baby girl.
That's a baby.
Yeah, she's going to be 1 in a couple of weeks. Thank you. And she keeps my hands full. She's the love of my life. I did not know true love until I became a mother. Better late than never, they say, and God's had his plan, and she's my everything. So I'm with her, that bonding. I'm always trying to teach her new words, new phrases. Yesterday we were playing patty cake, and just a lot of verbal, a lot of connection, a lot of bonding with my daughter, and very family oriented. I'm very close to my family. We're a small unit. I believe, that family is everything. And, I do believe in my faith, so I go to church every Sunday. Try to stay active. I'm trying to get back into the active, because I do want to practice what I preach. Sure. So staying healthy, just on my journey again to wellness. It's difficult after you have a baby, so
I wouldn't know.
Yeah, which is good. Yes, and so just getting back into the nutrition world, getting back into the exercise world, it can be tricky. And so that's where I'm at.
As a mother of a 1-year-old, I know you don't have a lot of free time, but when you do have free time, how do you spend it?
with her. I get
All the
home.
time, yeah.
Yes, I try to use my office hours and my time here on campus wisely, where I'm grading, I'm responding to discussions, I'm getting back to student emails, and then I get home and I just wind down with my daughter. She's in love with Miss Rachel, which is this education woman she's, oh my goodness, she's great. And so just like teaching her new songs, just giving her my undivided attention is usually how I spend my off
So
days.
no movies for mom, no nothing for mom.
I try, let's just say I try while she naps, but if she's like 3 hours and up, and then sometimes it's a 15-minute nap. We never know with Miss Samantha
Sure.
Faith. But she, right now I'm into a series, so I do watch Virgin River.
Okay.
And so I'm really into it, but again, I've been watching it already for almost like half a year. I can't even get through the first 3 seasons. Baby takes most of my time. Yeah.
Erica, anything you want to mention here at the end before we wrap it up?
I just want to say it's a privilege working with Laredo College. It's been so enlightening for me and my mental health, my mental wellness, and I'm excited to be here. And thank you for this opportunity to meet with you. And I hope that everything is clear as glass, and that I gave you a good insight as to how it is teaching for both campuses.
You absolutely did, and I think I'm going to take a kinesiology course now.
That's awesome.
But if I take it, do I actually have to pass, or?
Don't worry, you're good.
Okay.
No, just kidding. Yeah,
That's too
You'll
much
have
pressure.
fun.
Is
No.
it going to mess up my 2.8 GPA that I
No.
graduated with?
No, you're actually going to get an A.
All
So think
right.
positive.
All right, Erica, thank you very much for your time. I appreciate
Yes,
it. It's a
thank
pleasure.
you, Ruben.